Welcome to our deep dive into the world of COPD.
Oh, this is a big one.
It is, and thankfully we've got a fantastic resource to guide us.
Absolutely.
It's an article called Living Well with COPD, Empowering You with Knowledge and Strategies from the Advocate Voice.
You know, it's amazing how just that title alone gets to the heart of what we want to do today.
For sure.
To really equip people with the knowledge and
Yeah.
strategies.
Exactly.
To not just live with COPD, but to thrive.
Okay, so first things first.
Right to the basics.
What exactly is COPD?
So COPD stands for Chronic Obstructive Pulmonary Disease.
Mm-hmm.
And it's a progressive lung disease that makes breathing difficult.
And you know, when we say progressive,
Yeah.
that means it
It gets worse.
unfortunately gets worse over time.
Exactly. It's not something that just goes away on its own.
Right. And here's a fact that really blew my mind.
Okay, lay it on me.
COPD is the third leading cause of death globally.
That's right. It's a global health problem, and a major one at that.
I honestly had no idea it was that serious.
Well, it's often called an invisible illness. Because people may not realize how much it impacts someone's life.
Right. They might just see someone coughing or a little out of breath
Exactly.
and not realize what's really going on beneath the surface.
Right, and that's why this deep dive is so important.
Yeah. So let's get into the nitty-gritty. What's actually happening in the lungs with COPD?
So COPD is an umbrella term,
Okay.
meaning it covers a couple of different conditions,
Gotcha.
primarily chronic bronchitis and emphysema.
Okay. Chronic bronchitis. That one I've at least heard of before.
Most people have,
Right.
but they might not realize what it actually means.
So it's more than just a cough that hangs around too long.
Exactly. Chronic bronchitis is a long-term inflammation
Oh.
of the bronchial tube.
Those are the airways that carry air in and out
That's right.
of the lungs.
Exactly.
Got it.
And all that swelling and mucus buildup, it makes breathing a real struggle.
Like breathing through a straw that's constantly getting clogged.
That's a good way to put it.
Yeah. Okay. So how does emphysema fit into this picture?
So emphysema is a bit different.
Yeah.
It's all about damage to the alveoli.
Alveoli.
Yeah, those tiny air sacs in your lungs where oxygen and carbon dioxide are exchanged.
Right.
You can imagine them like tiny little balloons.
Okay.
Emphysema is like those balloons losing their elasticity and getting holes.
Oh, so they can't inflate and deflate properly?
Exactly, which means they become less efficient at exchanging those gases.
And eventually air gets trapped in the lungs.
You got it.
Wow. Those images are kind of scary.
They are. But they really help me understand what's going on inside.
That's the goal.
No wonder people with COPD have such difficulty breathing.
Right. It's not just about getting air in.
It's about getting it out, too.
Exactly. And all this puts a huge strain on the heart,
Oh, I see.
which is one reason why COPD is so serious.
Okay, so we've got the basics down.
The foundation,
Now I got asked about that statistic.
the 300 million,
300 million people worldwide with COPD.
it's mind-boggling, isn't it?
Mhm.
It really is. I mean, that's an enormous number.
And it's a number that's unfortunately on the rise.
The article mentioned it's especially prevalent in low and middle-income countries.
Right. Likely due to environmental factors.
Things like air pollution,
Yeah,
exposure to indoor smoke from cooking and heating.
exactly. Things that people in higher income countries might have less exposure to.
Right. And I was also surprised to learn that diagnoses are rising in women.
Yeah, it's true.
I always thought of COPD as primarily a men's health issue.
It used to be, largely due to differences in smoking habits.
Right, of course.
But over the past few decades,
Women have started smoking more.
sadly, yes.
Yeah.
And we're seeing the consequences of that.
Okay, so for anyone listening who's thinking, wait a minute, could I have COPD? What are the red flags, the symptoms that should prompt a visit to the doctor?
Such an important question,
Really is.
because early detection is key.
Absolutely.
So the article highlights a few telltale signs.
Okay.
Shortness of breath,
Okay.
especially during activity, a chronic cough that just won't quit.
Often worse in the morning.
Yeah,
Yeah.
that's common.
Okay.
Wheezing and chest tightness.
Especially during activity, right?
Right.
Okay.
Fatigue.
Okay.
And this isn't just normal tiredness. This
Yeah.
is fatigue that's really impacting your ability to function.
Because your body is struggling for oxygen.
You got it.
Okay.
And then frequent respiratory infections.
Like getting colds or the flu more often than usual.
Right.
Okay. So it's not just feeling a little winded after climbing stairs.
Right, that's more than that.
It's a persistent pattern
Exacts.
of these symptoms.
And if you're experiencing that, definitely see your doctor.
Now, we often associate COPD with smoking.
Right. That's the most common
But
cause.
the article stressed it's not the only one.
Definitely not.
Smoking might be the leading cause.
Accounting for about 85 to 90% of cases.
That's a huge percentage.
It is.
But there are other culprits, too.
Absolutely.
So what else should we be thinking about?
Well, environmental exposure is a big one, especially for people who've never smoked.
Things like air pollution,
Exactly.
workplace hazards.
Right, like dust, fumes, chemicals, all sorts of things.
Things that can really damage your lungs over time.
Exactly.
What about genetics?
That definitely plays a role. There's a condition called alpha-1 antitrypsin deficiency.
That's a mouthful.
It is.
What is that?
It's a genetic condition
Okay.
where people lack a protein that protects their lungs.
Interesting.
So even if they've never smoked.
They could still be at risk for COPD.
Exactly.
Wow. That's important to know.
It is. And then we also have to consider chronic infections.
Okay.
Repeated bouts of bronchitis or pneumonia.
Oh, right. Those can weaken the lungs over time
They do.
and make them more susceptible to developing COPD.
It's like your lungs are taking a beating over and over again.
Yeah, that makes sense.
Yeah.
And then, of course, there's secondhand smoke,
Ugh. The silent threat.
especially for children.
Absolutely.
So we've got a lot of potential culprits here.
We do.
Okay, so let's say you're experiencing some of these symptoms and you go to the doctor.
Good for you.
How do they actually diagnose COPD?
Well, a thorough evaluation is essential.
Of course.
Because these symptoms, they can overlap with other conditions.
Right. So how do they pinpoint COPD specifically?
The gold standard for diagnosis is a test called spirometry.
Spirometry.
Yep. It measures how much air you can inhale and exhale.
Okay.
And how quickly you can do it.
I've actually done that test before.
Have you?
Yeah. You blow as hard as you can into a tube.
That's it.
It seems simple, but I guess it provides valuable information.
It does. It tells us a lot about your lung function.
Okay, so that's one tool in the toolbox.
Right. We also use imaging techniques.
Like chest x-rays and CT scans.
Exactly.
But those don't diagnose COPD directly, right?
Not directly.
Okay.
But they can rule out other conditions.
Okay.
And they can show the extent of lung damage.
Which helps determine the severity of the COPD.
Exactly. They give us a visual of what's happening inside.
What about blood tests? Are those involved in the diagnosis?
Sometimes.
Okay.
There's a test called arterial blood gas analysis that checks your oxygen and carbon dioxide levels.
And that can tell you how well the lungs are functioning.
Exactly. And how severe the COPD might be.
So it's a multifaceted approach.
It is.
To making an accurate diagnosis.
And it's important to get it right.
Yeah, absolutely. The article also mentioned pulse oximetry.
Oh, yeah.
That people can use at home?
That's right.
I've heard of that, but what is it exactly?
It's a small device that clips onto your finger, and it measures your blood oxygen saturation.
So you can monitor your oxygen levels from the comfort of your own home?
In between doctor's visits?
That's fantastic.
Yeah.
I imagine that gives people a lot of peace of mind.
It does. It gives them more control over their health.
And helps them spot any potential problems early on.
Exactly.
Okay, so we've talked about the symptoms, the causes, and the diagnosis.
Yeah.
Let's move on to treatment.
Okay.
What are the options available in 2024 for managing COPD?
Well, the good news is that we have a lot of tools in our arsenal.
That's good to hear.
To help people live well with COPD.
Okay.
Inhalers are still a cornerstone of treatment.
Those are the little handheld devices that deliver medication directly to the lungs.
Right into the airways where it's needed most.
Okay, and there are different types of inhalers.
Right. There are short-acting inhalers for quick relief, like albuterol, and then there are long-acting inhalers for more sustained control.
Okay, like what?
Like tiotropium.
Tiotropium.
Yeah.
Okay.
And often doctors will prescribe combination inhalers.
Makes sense.
That include both a bronchodilator.
Open up the airway.
Exactly.
Okay.
And a corticosteroid.
To reduce inflammation.
You got it.
Corticosteroids, those are powerful anti-inflammatory.
They are. They work by reducing swelling in the airways.
Which makes breathing easier.
Exactly.
But I know they can have side effects.
That's why doctors use them carefully.
It's always about weighing the benefits and the risks of any medication.
Absolutely. And sometimes for more severe cases or during flare-ups, doctors might prescribe oral or injected corticosteroids for a short period of time.
What about oxygen therapy? When does that become necessary?
Oxygen therapy is a lifesaver for people whose blood oxygen levels drop too low.
How low are we talking?
Usually below 88%.
Okay.
It helps the body get the oxygen it needs to function properly.
And I imagine being tethered to an oxygen tank
Yeah.
can be quite restrictive.
It can be. But thankfully, portable oxygen devices have come a long way.
Oh, that's good to hear.
People can stay active and independent while using supplemental oxygen.
That's fantastic. So we've talked about medications and oxygen therapy.
Right.
What other treatments are available?
Well, pulmonary rehabilitation is a game changer.
Okay. Pulmonary rehab.
Yep. It's a holistic approach that involves exercise training, nutritional counseling, and education.
So it's not just about puffing away on an inhaler?
No, it's about taking a multifaceted approach
to managing COPD.
You got it. Pulmonary rehab helps people improve their lung function, manage their symptoms, and regain their quality of life.
That sounds promising. And beyond these established treatments, there are some new things on the horizon.
There are some really exciting developments.
Like what?
Like biologics.
Biologics.
And stem cell therapy.
Okay, biologics, those are drugs that target specific molecules involved in inflammation.
Exactly. Like you might see with rheumatoid arthritis.
Right.
Now they're being explored for COPD.
Specifically?
For people with a subtype called eosinophilic inflammation.
Okay.
And these biologics might help reduce inflammation and prevent those debilitating flare-ups.
That would be amazing.
Yeah.
And what about stem cell therapy?
That one's still in the experimental stages for COPD.
Okay.
But the idea is to use stem cells to regenerate damaged lung tissue.
Wow. So it's about actually repairing the damage.
Right. Not just managing the symptoms.
That's incredible.
It is.
A lot happening in the world of COPD treatment.
There is. It's an exciting time.
It's encouraging to know that there are so many avenues being explored.
Absolutely. And while these treatments address the medical side of things, we can't forget about the importance of lifestyle changes.
Right. It's not just about pills and inhalers.
It's about making changes to your daily life.
That support lung health.
Exactly.
So let's dive into those lifestyle tips.
Okay.
In part 2 of our deep dive. All right, we're back and ready to talk about those lifestyle changes that can make a big difference for people with COPD.
This is where the rubber meets the road.
Right, exactly.
Yeah.
It's time to get practical. What can people actually do to feel better?
Well, if you're a smoker with COPD, there's really no way around it.
Yeah.
Quitting smoking is priority number 1.
Easier said than done.
It is, but it's crucial.
How much of an impact does quitting actually have? I mean, when the damage is already done.
A huge impact.
Seriously.
It's the single most important thing you can do to slow down the progression of COPD.
It won't reverse the damage.
No, unfortunately not.
Okay.
But it can prevent things from getting worse.
Okay.
And some people even see improvements in their breathing.
Over time.
Yeah.
So it's never too late to quit.
Never.
But it takes a lot of willpower.
And support.
Right.
The article suggested setting a firm quit date, getting rid of any triggers.
Like ashtrays and lighters?
Yeah, things like that.
Okay.
Find healthy ways to cope with cravings and seek support from friends, family, or support groups.
It sounds like a combination of approaches.
It is.
It's really key.
And there are also things like nicotine replacement therapy, medications, quit lines, counseling.
All those things can help.
Absolutely.
Okay, so beyond quitting smoking, what are some other lifestyle tweaks that can make living with COPD easier?
Creating a COPD-friendly environment at home is a big one.
Ooh, I like that.
A lung sanctuary.
A lung sanctuary.
Right, exactly.
What does that look like, though?
Well, first you want to minimize indoor pollutants.
Okay.
So ditch those harsh cleaning products.
Okay.
Scented candles, air fresheners.
Anything that can irritate your lungs.
Right. And invest in an air purifier with a HEPA filter.
Makes sense. Especially if you live in an area with high pollution.
Or if you have allergies.
Right. So it's about being mindful of the air you breathe.
Inside and out.
What about exercise? Is it safe for people with COPD to be physically active?
It's not just safe.
Okay.
It's essential.
Really?
But the key is to start slow. Listen to your body.
Right.
And don't push yourself too hard.
What kind of exercises are we talking about?
Gentle exercises like walking, yoga, tai chi, even chair exercises if you have limited mobility.
Oh, I love that you mentioned tai chi.
Oh, yeah.
Such a mindful practice. That emphasizes deep breathing and controlled movements.
And that focus on breath control can be so helpful for people with COPD.
It's all about finding activities you enjoy that you can do safely.
Even if it's just for a few minutes each day.
Right. Small amounts of exercise can still make a difference.
Absolutely.
So finding that sweet spot where you're challenging yourself, but not overexerting yourself.
Exactly. Now let's talk about another important aspect of a COPD-friendly lifestyle.
Okay.
Diet.
Okay, diet. What should people with COPD be focusing on when it comes to nutrition?
A balanced, nutrient-rich diet is key.
Okay.
Plenty of fruits and vegetables.
Those are always good.
They are.
Yeah.
But they're especially important for people with COPD.
Okay.
They're packed with antioxidants and vitamins that support lung health.
And boost your immune system.
Exactly. And don't forget about omega-3 fatty acids.
Omega-3s.
Yeah.
Found in fatty fish.
Like salmon, tuna, mackerel.
Okay.
They have anti-inflammatory properties.
Good for the lungs.
And high-fiber foods are important, too, for maintaining a healthy weight and preventing constipation.
Which can make breathing more difficult.
Exactly.
So a heart-healthy diet.
Is a lung-healthy diet.
Absolutely.
And staying well hydrated is crucial.
Water, water, water.
Right. Water helps thin the mucus in the airways.
Making it easier to cough up.
You got it.
Okay, so we've covered quitting smoking, creating a healthy environment, getting regular exercise,
Right.
eating a nutritious diet, and staying hydrated.
It's a lot to remember.
It is.
But you don't have to do it all at once.
Right.
Start small.
Okay.
Focus on 1 or 2 things at a time.
Right.
And gradually incorporate more healthy habits into your routine.
It's about progress, not perfection.
Exactly.
But even with the best intentions, flare-ups can still happen.
Unfortunately, they can.
So let's talk about preventing those dreaded flare-ups.
Okay.
What are the key things people should be aware of?
Well, the first step is recognizing the early warning signs.
All right.
Pay attention to any changes in your breathing patterns, your cough, your mucus production, or your energy level.
If something feels off, don't ignore it.
Exactly. Be in tune with your body.
Right.
Notice those subtle shifts.
Before things escalate.
Right. And once you're aware of those early signs, you can start taking steps to avoid common triggers.
Like what?
Air pollution is a big one.
Of course.
Check the air quality reports.
Okay.
And limit your exposure on bad air days.
Stay indoors.
Yeah.
Maybe exercise at the gym instead of outside.
Or even wear a mask if needed.
Okay. What else?
Allergens can also be a trigger.
Allergens like dust mites and pollen.
Exactly. So if you know you're sensitive to those things, take steps to minimize your exposure.
Air purifier.
Yeah.
Dust regularly. Wash bedding frequently.
Good ideas.
Keep those pets well groomed.
Exactly.
Yeah.
And don't forget about cold weather.
Oh yeah, cold air can be a trigger.
It can wear a scarf or mask over your mouth and nose.
To warm the air you breathe.
Right. Especially when you're outside.
Makes sense.
Yeah.
Okay, air pollution, allergens, cold weather. What about smoke?
Oh, absolutely. Avoid smoking and secondhand smoke.
Yeah, that goes without saying.
Right. And strong odors and chemicals can also be triggers.
Like perfumes, cleaning products, paint fumes.
All of those things can irritate the lungs.
Okay. It sounds like it takes a lot of vigilance.
It does.
Constantly being aware of your surroundings.
Right.
And potential triggers.
But it's worth it to avoid those flare-ups.
For sure. Here's another one that seems obvious.
Okay.
Vaccinations.
Oh, yes. Vaccinations are crucial.
Especially for flu and pneumonia.
Right. Because getting sick on top of COPD can be really dangerous.
Those infections can trigger major flare-ups.
And land you in the hospital.
So talk to your doctor about getting the flu vaccine every year.
Yes.
The pneumococcal vaccine for pneumonia. And, of course, the COVID-19 vaccine.
They all help protect your lungs.
Absolutely.
Okay.
Okay, so you've done everything right.
Okay.
You've avoided your triggers. You've stayed up to date on your vaccinations.
Right.
But a flare-up still happens.
It happens.
What do you do?
That's when you need a plan.
A COPD action plan.
Exactly.
Okay, break it down for me. What is that?
It's a personalized guide that you create with your doctor.
Okay.
Outlining what to do when your symptoms worsen.
So you know what to do when you're not feeling well.
Exactly. It takes the guesswork out of it.
What kind of information does it include?
Well, it should include information about your medications, like your rescue inhaler or oral corticosteroids. It should also tell you when to increase the dosage of your regular medications and when to call your doctor or seek emergency care.
Put a roadmap.
It is.
For managing those flare-ups.
And preventing them from spiraling out of control.
Right. Having that plan in place can really reduce the stress and anxiety.
It gives you a sense of control.
And helps you make informed decisions.
Exactly.
When you're not feeling your best.
And it can prevent unnecessary trips to the ER.
Right, because you know what to do at home.
Exactly. But it's still important to know when a flare-up is serious.
Okay, so what are those red flags?
Yeah.
That should send you straight to the emergency room?
Severe shortness of breath.
Okay.
That doesn't improve with your rescue inhaler.
Okay.
Bluish lips or fingertips.
That's a sign of low oxygen, right? It's okay.
Rapid or irregular heartbeat. Confusion.
Okay.
Extreme fatigue, chest pain.
So if you're experiencing any of those symptoms,
don't wait.
Go to the ER.
Exactly.
But with proactive management,
right,
those severe flare-ups can become less frequent.
and less intense.
So it's about taking control
Yeah,
of your COPD.
rather than letting it control you.
And with all the advancements in treatment
Mm-hmm.
and this holistic approach to care,
Right.
living well with COPD is more attainable than ever.
Absolutely.
But there's one more crucial aspect of COPD that we need to address.
Oh, yes.
The emotional and psychological impact.
That's so important.
It's not just about the physical symptoms.
It's about the whole person.
Exactly.
Yeah.
So let's explore that.
Okay.
In part 3 of our deep dive. We've covered a lot of ground in this deep dive into COPD.
We have, from the science of it all.
Right, the ins and outs of the lungs.
Well, the practical tips for managing those symptoms and preventing those flare-ups.
But now it's time to talk about something just as important.
Oh, absolutely.
The emotional side of living with COPD.
You know, it really is something that often gets overlooked.
Yeah.
But it's so crucial.
It's not just about dealing with the physical limitations.
Right.
It's about navigating those emotional ups and downs
You hit the nail on the head.
that come with a diagnosis like this.
The article we've been discussing really highlighted how COPD can impact your mood, your relationships, your sense of self.
It affects everything.
It really does. It's a lot to process.
It is both physically and emotionally.
Absolutely. You might experience anxiety, fear, frustration, even sadness or grief over the limitations that COPD can impose.
It can be really isolating.
It can.
Feeling like your body is betraying you.
Yeah.
Like you can't do the things you used to.
And sometimes those around you might not understand what you're going through.
They might have the best intentions.
Oh, absolutely.
But say things like, just push through it.
Yeah.
Or you'll feel better tomorrow.
Which can actually make you feel worse.
It's like they're minimizing your experience.
Yeah, exactly.
That can be so invalidating.
So how do you cope with all of that?
Yeah. Where do you even begin?
Well, the first step is to acknowledge those feelings.
Okay.
Don't try to bury them or pretend they're not there.
Right.
Give yourself permission to feel whatever you're feeling.
It's okay to not be okay.
Exactly. Whether it's anger, sadness, fear, frustration.
It's about being kind to yourself. Recognizing that it's okay to have these difficult emotions.
We're all human.
Right.
We all experience these things.
And once you've acknowledged those feelings, it's important to find healthy ways to express them.
Absolutely.
So what does that look like?
Talking to someone you trust can make a huge difference.
Okay.
A friend, a family member, a therapist, a support group.
Just getting it out there.
Sharing your experience and letting it all out.
Can be so cathartic.
It can.
And you might be surprised by how many people can relate.
Right. You're not alone in this.
There's power in shared experience.
Absolutely. Millions of people around the world are living with COPD. And many of them have felt those same emotions.
So talking it out is one approach.
Yeah.
What about other coping mechanisms? Are there things people can do to manage those feelings of anxiety or fear?
The article mentioned breathing techniques.
Okay.
Which can be really helpful.
Right, especially during moments of breathlessness.
Or things like pursed lip breathing can help slow your breathing down and calm your nervous system.
It's amazing how something as simple as changing your breathing can have such a profound impact.
It really is.
On your mental state.
And it's something you can do anytime, anywhere.
That's the best part.
Right. What about mindfulness and meditation?
Oh, those are my go-tos.
Really?
I'm a big believer in mindfulness.
It's so helpful.
Those practices really help you be present and aware.
It's like pressing the pause button
Yes.
on all that mental chatter.
And just focusing on the present moment.
Exactly.
We talked earlier about social connection.
We did.
How does that play into managing the emotional side of things?
Well, staying connected is essential for combating those feelings of isolation and loneliness.
Right. It's easy to withdraw when you're not feeling well.
It is. But it's important to resist that urge.
So what can people do to stay connected?
Joining a COPD support group can be a game changer.
Okay.
Either online or in person.
It's a great way to connect with people who understand.
To share tips and strategies.
Offer each other encouragement and support.
It's about creating a community.
It is.
A network of people who get it.
Exactly.
Yeah.
And don't underestimate the power of spending time with loved ones,
Yeah.
engaging in activities you enjoy, or finding new hobbies.
It's about nurturing your spirit,
Yes.
finding those moments of joy.
Even amidst the challenges.
It's about finding that balance, recognizing that COPD is a part of your life,
Yeah.
but doesn't have to define your life.
Perfectly said. And if those feelings of anxiety or depression become too overwhelming, don't hesitate to seek professional help.
Absolutely.
A therapist can provide coping strategies,
Okay.
medication if needed, and a safe space to process your emotions.
There's no shame in seeking professional help.
Not at all.
It's a sign of strength.
It's not weakness.
It's a crucial part of taking care of your overall well-being.
I love that perspective. It's not just about treating the disease.
Right.
It's about supporting the whole person.
Exactly. And I think it's worth reiterating that the article we've been discussing ended on such a hopeful note.
It did.
Emphasizing that even though COPD is a chronic and progressive condition,
Right.
there's still so much you can do
To live a fulfilling and meaningful life.
It's a call to action.
I love that.
Yeah.
A call to action.
So as we wrap up this deep dive,
Yeah.
what are the key takeaways you want to leave our listeners with today?
I think the biggest takeaway is that knowledge is power.
Absolutely.
The more you understand about COPD, the better equipped you'll be to manage it.
And live your best life.
And you don't have to go through this alone.
Never.
Reach out to your healthcare providers.
Yeah.
Connect with support groups. Lean on your loved ones.
There's a whole community out there.
Ready to support you.
Remember that even small changes can make a big difference.
Oh, true.
Whether it's quitting smoking, incorporating gentle exercise, or practicing mindfulness.
Every step counts.
It does.
And for those who want to dive even deeper, we recommend checking out the CDC,
Great resource.
NIH,
Absolutely.
and the American Academy of Family Physicians.
Excellent resources.
So as we wrap up this deep dive into the world of COPD, remember, living well is possible.
It is.
It's about taking charge,
Yes.
finding support, and embracing the journey with hope and resilience.
Beautifully said. Thanks for joining us on this deep dive.
Until next time, stay curious and keep learning.